Welcome back. The program is DatelineAbuja. Today my guest is Dr. Christopher Otabor. He is a consultant orthopedic surgeon. You're welcome to DatelineAbuja, sir.
Thank you.
We'll be discussing medical tourism. Can you define what medical tourism is?
Okay. Medical tourism can be defined simply as a situation where someone crosses an international border to access medical treatment. That's the simple definition.
Simple. When people travel to seek medical treatment.
Once you cross an international border, if you travel from Benin to Lagos, you haven't crossed an international border.
No, you haven't.
But if you travel from Lagos to Republic of Benin or to Cotonou or to Ghana for medical treatment, you have indulged in medical tourism.
Okay. Well, what would you say the present state of medical tourism is in Nigeria right now?
Well, it's quite rife. A lot of people, especially the rich and those who have sponsors, they go outside of the country to get medical treatment, especially to places like India, Egypt, and European countries. It's quite it's significant, and it's explainable. There's erosion of confidence in the Nigerian medical system.
Do you want to give us more reasons? That's one of my next questions. Why do you think the people travel out seeking medical treatment?
Yeah, you see, there are the pull and the push factors. There are things in those countries that are pulling Nigerians, and then there are things in Nigeria that are pushing Nigerians.
Like, explain.
Yes. Yeah, for instance, the pull factors. You look at the ambience in those hospitals in India and other places where Nigerians go to. The facade is quite attractive. They've invested a lot of money in building edifices that speaks for themselves. And apart from that, also they've invested in equipment and health infrastructure. Then they are also, to a large extent, organized. Yes, they've been able to, as it were, tap into the private sector to bring in the necessary funding that is required to invest in the health sector, and they are reaping the dividends of it. Yes, and cost too. Sometimes it may actually be cheaper to have treatment in a place like India than in Nigeria.
How so?
Yeah, because they've dealt with their power problem. They've dealt with so many mitigating factors that entrepreneurs in Nigeria will have to battle with for them to be able to break even. If you go to India, you may never have a blink of light for 3 months at a stretch. But in Nigeria, the reverse is the case. You see some people using torchlights to do operation.
Wow.
Yes.
Wow.
In the hinterland, but it's not as bad. Things are improving now. But in some areas, then also the stability in the health system over there. Here, there's so much emphasis on the government hospitals, and government is not well positioned to answer to the needs, and so people tend to jet away. But recently, the private health system in Nigeria is coming up very strong, and it's rising up to the challenge. And medical tourism, I would say, in the last 5 years, is reducing. Yes, but it's still very significant. It's estimated that over $1 billion is spent on medical tourism annually.
Wow.
Yes, and that's like 3.5 billion, $1 billion. That's like 350 billion naira. That's a huge amount of money. Yes, so these are some of the factors, but there are a few who just want to travel as a status symbol.
Yeah.
But by and large, it's because of factors prevailing here. Think of the incessant strike by the doctors in the government hospitals. So those things, they tend to erode confidence. Yes. But the interesting thing is that when you go to these countries, you find out that it's Nigerians that are running the show there.
Wow.
Yeah.
Wow.
Yes.
What do you think the government is not doing right to reduce medical tourism?
Okay. Yeah. I think there's a misplaced concreteness. There's the government presently thinks that as a government they can handle the healthcare system alone. So you find out that some government policies tend to fight the very sector that can solve the problem.
Wow.
Yes.
I want to break that down.
Yes, as it were today, it looks like the fight is between the private sector and the government. And it's supposed to be collaborative, not antagonistic. Recently there was a rising from the Federal Executive Council meeting. The Minister of Health addressed the nation and said private doctors in government hospitals are not allowed to engage in private practice. That's just one of the signs of the antagonism. Some of us who at our spare time still will give of our time to private practice. We also work with government. We do more of philanthropic work with the government hospitals. We do more of sacrifice. 100% of my equipment I take to the government hospitals to do surgeries. And the patients are poor, so they don't even have the money. We don't even talk about payment for those equipment. We do it for them free. And government cannot buy these things. So it's a matter of helping the poor.
Wow.
So most doctors, most consultants that work in government hospitals that do their private practice, their private practice is actually helping the government hospitals.
Because they're using your equipment
Yes.
for the public.
Yes. So that's one. Now, the only people that can stop medical tourism is the private sector. And that's how it has been in most of the countries where Nigerians go to.
Do you want to explain?
Yes. 95% of the hospitals Nigerians go to in India are privately owned. They are not government hospitals.
Yeah.
But what the government does is to create the enabling environment
For them.
Yes. One, they give them tax holidays. They give them chief source of funds. Loan at very low, ridiculously low interest, less than 10%. So that after investing, you can still be able to break even. And many of the hospitals are not owned by doctors. They are owned by investors who have come to understand that the health system is a gold mine for investment. Yes. But because of the peculiarity of the Nigerian environment, cost of fund is high and return on investment is slow in the health system. Nigerian businessmen don't want to go into it, and I don't blame them much. If you go to the bank to get a loan, the least you can get is 30%. And before you finish investing the money, they've started coming for payment. And it doesn't work that way with the health system. It takes time for it to mature. And then there are so many issues that entrepreneurs will have to contend with. Issue of power, issues of, different levies from different
Government policies.
Yes. Government is fighting the private sector. The local government will come, the state will come, the federal will come, television tax, all sorts of tax, tenement rate and all that. So it suffocates the private sector. And at the end of the day, you are left with little money to invest or reinvest in the health system. So once there's no fluidity, no cash flow in the system, you cannot do much And so what happens? You can't procure the necessary equipment that's required for first-class medical services. And for those who have the money, they will always find a way to go out there and get it. Yes, that's so, because health is personal, and you can't live twice. So if you have the money, you want to get the best.
Yes. But you just talked about something about it's only the private consultants that can actually reduce medical tourism or medical trips. You as a private, what do you think you can do?
We're already doing a lot.
Okay. Do you want to share that with us?
Yeah, we do quite a lot. That some of the things we've done are even the first in the country, like the open heart surgery. Where we did a modified Bethel operation, massive surgery, 7 hours, replaced the aorta, the main trunk that takes blood away from the heart.
And it was successful.
It was successful, and that's the first that is being done in this country. Then, as a routine, we do complex spine operations, we do joint replacement operations, we do brain surgeries. Brain
surgeries?
Yes, very complex brain surgeries. We even operate Indians here. To a large extent, as a hospital, we have created a dent in medical tourism, because majority of the patients we see here are people who are supposed to be going abroad for treatment. And what are the things that take Nigerians abroad? Heart issues, orthopedics, that's bone, joints, limb reconstruction, kidney problems.
You just mentioned the brain.
Yes, the brain and spine. If you take those ones, then the rest are just little, except for cancer treatment and all that. So this is the bulk, and there are centers in the country that have risen, and we are rising to the challenge, and a lot is happening now.
Oh, beautiful.
Yes.
Okay, can you tell us the risk of medical tourism? I know that every good thing also always has a bad side about it. It's good you get your treatment from professionals if people feel, or because they don't have power outage, etc. But I'm sure they also have negative impacts of traveling out.
Yeah.
Can you share that with us?
Yes. First of all, as a surgeon, once you have operated a patient, the patient is supposed to be yours for life. That means that follow-up is key. But when you go to India for treatment, you won't always be going for follow-up. There's usually 2 weeks follow-up, 1 month follow-up, 2 months follow-up, and so on and so forth. But in the absence of your surgeon close by, what do? You would have to fall back. Sometimes we clean up the mess that the Indian surgeons have created. Yeah, because in those places, especially in India, we still have charlatans, bad guys who claim to be what they are not. And Nigerians fall into those bad hands, and they are maimed. Some are killed. Yes. In India, we have the best of the hospitals. We also have the worst of the hospitals. So if one is not properly guided, he can fall into the wrong hands. And I tell you, there are a lot of Indian doctors that claim what they are not. Yes. And because you are a foreigner, your rights cannot be as protected as when you're in Nigeria.
Yes.
That's one. There was a time it was in the news that there was a particular microorganism, a bacteria, that was discovered in India. There's no antibiotics that work for it. Yes. And we have to warn some for our patient that if you are going, you might just come back with that bacteria. Yes. It's a type of methicillin-resistant Staph aureus, not amenable to any antibiotics.
Wow.
So you can pick up such.
Where you travel.
Yes. If you Google, you see it. Then also, apart from the issue of follow-up and some falling into charlatans, if you have your surgery in a far country and you have to fly very soon, there's such a phenomenon as deep vein thrombosis. when the blood clots within the veins. Depending on the magnitude of the surgery one has performed, has undertaken, there's a tendency for the blood to be thicker than normal.
Blood clot?
The blood viscosity itself will be thicker than normal. So it has the tendency to clot in the vein. And when that happens, it can move to the heart and block the vessels in the heart or the lungs, and that will be instant death. You may have seen some people that soon after, coming down from the aircraft, they just slump and die.
Wow.
And that's as a result of a deep vein thrombosis, blood clot moving into the.
That's immediately after surgery.
Soon after surgery, usually up to 6 weeks, 3 months after surgery, the blood has not come down to normal exactly.
Oh.
Yes. So we don't have the statistics.
Oh.
I've seen people who tell me, my mom went to India. She had a successful surgery, but she just slumped and died 1 week after coming back.
Oh.
But we don't have the statistics.
Are you saying is the time they spent sitting down in the plane?
Yes. There's a predisposition. The surgery predisposes them.
Okay.
To the blood clots, and then when they fly the high altitude, it also makes it worse. The risk now gets higher, and the blood can clot at any time during the flight. Even normal people, they are predisposed to it. That's why we say use your stockings. If you fly first class in aircraft, many times they give you the stockings. Yes. So for people who are predisposed, we tell them take your aspirin, take your blood thinners, so that there was a minister that passed away, the former minister of transport. He flew in from the US, landed from the aircraft and slumped. He had a deep vein thrombosis. But if one had done the surgery, the risk is now higher.
Oh.
He could have been at the airport, he could have been at home, it could be 1 day after, it could be 2 days after, depending on the rate of formation of the clot. So those are some of the hidden risks that people don't know about. They just jump in, jump out. It may not happen to many people. That's
for surgery. What about giving birth? We know a lot of Nigerians travel to America, Ireland, and etc. to give birth.
Yes, that risk is there depending on the age. The risk is there. Yes, because around the pregnancy, the hormones are working. The tendency for clot formation is still there. So there's a risk, though it's small, but it's there. But for the person that it happens to, it's 100% for him and the family. Yes. So if you might say, well, it can happen in 3 out of 1,000 people. But for those 3, for that person, even if it's 1, it's significant for that one person. Yes. Then we talk about the economic effect of it. If, let's say, we do 400 billion that we lose to medical tourism annually, if that money is kept here, it can build 100 massive hospitals.
Oh, brilliant.
Yes. 4 billion can build a good hospital in Nigeria.
Yeah. What are the ways you think that the government can improve medical tourism or stop it?
We're still coming back to the earlier question you talked about. First of all, it's been proven that government cannot stop medical tourism.
There should be some ways.
Yes, they can't do it themselves, but they can encourage the people that can stop it.
Oh,
yes,
yeah,
yes. Government should focus on what they are good at doing, and that is primary healthcare, and secondary healthcare, immunization, stoppage of epidemics, outbreak of diseases, nutrition, those things that can help prevent diseases. But when the disease is well established and it is a tertiary case, they should encourage the private sector to handle them. How do they do it? We can learn from the Indian example. There's no need to reinvent the wheel. 1, create an enabling environment. Let there be partnership between the private sector and the government, not antagonism. Yes, because even now, about 65 to 70% of the patients in the country are seen by private hospitals. you would think that government workers are more in number than
yes,
private
I think
workers.
so, because in every local government, I wanted to just say, excuse you there, because in every local government, even in towns and villages, we have at least a government hospital.
Look,
compared to private clinics.
Let just draw an analogy from the civil service.
Okay.
The state with the highest number of staff in this country is Kano State, and there are about 160,000 civil servants in Kano State. That means most states have less than that. And Kano State has a population of over 9 million people, and 160,000 are civil servants. But the way we look at government, we think, oh wow, everybody's working with government.
Okay.
Do you get it? So the same thing. By the time you count 5 hospitals, 10 hospitals, maximum 20 hospitals in any particular state, you've finished counting the government hospital. But in this FCT alone, you have over 1,000 hospitals.
Wow.
Yes, and not more than 30 or 20 are government. The rest are private. Yes.
We're wrapping up. We don't have enough time, but I just wanted to use this opportunity to talk to investors. If we now feel that the way to go is actually looking at investors coming in to help or in collaboration with...
It has to look beautiful for investors to bring in.
Okay, so what are you people doing? Use opportunity to tell investors that, hey, this is a gold mine you're sitting on. You know, we need to stop medical tourism. We need to improve our healthcare. So use this opportunity to talk to you. You may not know who will be interested in investing.
Well, during the economic meltdown in the US, the only sector that was not affected was the health sector. People were going to take courses in medicine, in medical sciences, so that they can still be employable. Healthcare is the biggest business in the world because people must fall sick. Even if they are not sick, they must remain well. They want to remain well. So anybody who invests in the health sector may not get the money today, but it's a sure and viable place to invest.
Oh, thank you so much. Well, I've been talking to Dr. Christopher Otabor. Is a consultant orthopedic surgeon here in Abuja. You're watching Dateline Abuja. Stay tuned. I'll be right back.